SOP on preventive measures to contain spread of COVID-19 in religious places or places of worship. Point 1. Background. Religious places or places of worship get frequented by a large number of people for spiritual solace. To prevent spread of COVID-19 infection, it is important that required social distancing and other preventive measures are followed in such premises. Point 2. Scope. This document outlines various generic precautionary measures to be adopted in addition to specific measures to be taken at particular places to prevent spread of COVID-19. Religious places or places of worship for public in containment zones shall remain closed. Only those outside containment zones will be allowed to open up. Point 3. Generic preventive measures. Person above 65 years of age, persons with comorbidities, pregnant women, and children below the age of 10 years are advised to stay at home. Organizations managing the religious institutions to advise accordingly. The generic preventive measures include simple public health measures that are to be followed to reduce the risk of COVID-19. These measures need to be observed by all workers and visitors in these places at all times. These include 1. Individual must maintain a minimum distance of 6 feet in public places as far as feasible. 2. Use of face covers or masks to be mandatory. 3. Practice frequent hand washing with soap for at least 40 to 60 seconds even when hands are not visibly dirty. Use of alcohol-based hand sanitizers for at least 20 seconds can be made wherever feasible. Respiratory etiquettes to be strictly followed. This involves strict practice of covering one's mouth and nose while coughing, sneezing with a tissue, handkerchief, flex elbow, and disposing of used tissues properly. 5. Self-monitoring of health by all and reporting any illness at the earliest to state and district helpline. 6. Spitting should be strictly prohibited. 7. Installation and use of Arogya Setu app shall be advised to all. Point 4. All religious places shall also ensure 1. Entrance to have mandatory hand hygiene, sanitizer dispenser, and thermal screening provisions. 2. Only asymptomatic persons shall be allowed in the premises. 3. All persons to be allowed entry only if using face cover or mask. 4. Posters or standees on preventive measures about COVID-19 to be displayed prominently. Audio and video clips to spread awareness on preventive measures for COVID-19 should be regularly played. 5. Staggering of visitors to be done if possible. 6. Shoes or footwear to be preferably taken off inside own vehicle. If needed, they should be kept in separate slots for each individual or family by the persons themselves. 7. Proper crowd management in the parking lots and outside the premises, duly following social distancing norms, shall be organized. 8. Any shops, stalls, cafeteria, etc. outside and within the premises shall follow social distancing norms at all times. 9. Specific markings may be made with sufficient distance to manage the queue and ensure social distancing in the premises. 10. Preferably, separate entry and exits for visitors shall be organized. 11. Maintain physical distancing of a minimum of 6 feet at all times when queuing up for entry. 12. People should wash their hands and feet with soap and water before entering the premises. 13. Sitting arrangement to be made in a such way that adequate social distancing is maintained. 14. For air conditioning or ventilation, the guidelines of CPWD shall be followed, which inter alia emphasize that the temperature setting of all air conditioning devices should be in the range of 24 to 30 degrees Celsius. Relative humidity should be in the range of 40 to 70%. Intake of fresh air should be as much as possible and cross ventilation should be adequate. 15. Touching of statues, idols, or holy book, etc. not to be allowed. 16. Large gatherings, congregation continue to remain prohibited. 17. In view of potential threat of spread of infection, as far as feasible, recorded devotional music or songs may be played and chore or singing groups should not be allowed. 18. Avoid physical contact with greeting each other. 19. Common prayer mats should be avoided and devotees should bring their own prayer mat or piece of cloth which they may take back with them. 20. No physical offerings like prasad or distribution or sprinkling of holy water, etc. to be allowed inside the religious places. 21. Community kitchens, langars, annadan, etc. at religious places should follow physical distancing norms while preparing and distributing food. 22. Effective sanitation within the premises shall be maintained with particular focus on lavatories and hand and foot washing stations areas. 23. Frequent cleaning and disinfection to be maintained by the management of the religious place. 24. The floors should particularly be cleaned multiple times in the premises. 25. Proper disposal of face covers, masks, gloves left over by visitors and or employees should be ensured. 26. In case of a suspect or confirmed case in the premises, A. Place the ill person in a room or an area where they are isolated from others. B. Provide a mask or face cover till such time he or she is examined by a doctor. C. Immediately inform the nearest medical facility or call the state or district helpline. D. A risk assessment will be undertaken by the designated public health authority, district RRT, or treating physician, and accordingly further action be initiated regarding management of case, his or her contacts, and need for disinfection. E. Disinfection of the premises to be taken up if the person is found positive.